Officials recently announced the Boston Public Schools plan to reopen September 21st with all remote learning to be combined later with time in the classroom. The timetable also allows for more preparation and learning more about the needs of families. To bring us up to date is Boston School Superintendent Dr. Brenda Cassellius. Thank you very much for being with us, Superintendent.
Thank you, Chris.
So, Superintendent, start with the survey of the families right now. What are you trying to find out, and what do the parents have to factor into their decisions?
Well, there's a lot for parents to think about. It's, really about the safety and health of their own children. That's first. Of course, some of our students do have underlying conditions, and so we want to make sure that parents understand those risks with being in person, whether that's at the grocery store, or the playground, or at school. So I think that's a really important consideration. Of course, their own family schedule. And how many siblings are in the house in order to help students sign on, as well as their ability to help them sign on and stay connected and engaged in their learning.
Well, I know there is still the option for families to go all remote if that's what they want. On the other hand, there are people who are like the idea of at least some in-person education, but it's so difficult to know the safety of an individual building and, the infection rates of the populations in the school. I mean, isn't that really beyond the ability of people to factor in?
So, of course, we don't have a lot of control other than our own personal contribution to the overall health of the community by wearing our mask, washing our hands, social distancing, and avoiding crowds or going out when you're sick. The more we do our part, the more that will bring down the number within the community. And I always are saying to everybody that, the best way for us to get children to their classroom with the teachers that love them is for us adults right now to do our part. And being safe and complying with the guidance. But as far as our facilities go, we have all of our facilities will be ready to go when we open up for our first wave of students to come in. And they've been working all summer on replacing windows, fixing our bathrooms. They even fixed faucets and changed the timer for the hot water to come on, so that hot water comes on a little faster for them for washing their hands, and just getting all of our systems ready to go.
And the deadline for parents to respond to the survey, what should they be thinking of?
Well, the deadline is this Friday, but I do want parents to know that we are always going to continue to work with them and reach out. So we have our hub dialer technology where we're making phone calls and have been doing so since Monday. And then we'll also pass it off to our teacher teams and our principals as well when they report back to school to try to reach out to all of our families and do a touch point.
Well, one thing that's evident from the plan at this stage is that you still have the goal of some in-person learning, the hybrid form being most likely. What does that say about what you heard earlier from stakeholders? You had a lot of meetings with them. What were they telling you?
So we really heard from our stakeholders, and we actually did an equity analysis that has been very informative to our planning as we look at our highest need students and serving them first. And so most families were telling us that they wanted to gradually come back to school, that they wanted for sure to have safety and the facilities ready to go. And they wanted to improve upon the remote learning that we had this spring, of course, as we quickly closed within just 4 days of spring. In the springtime, because of COVID, there was a lot we didn't know. And we were just in a supplemental phase for the first 6 weeks of that. So it was sign on if you can. And, as we were delivering the 32,000 Chromebooks and getting families Wi-Fi, very different situation than we are going to be in this fall, which will feel a lot more like regular school, and kind of our new normal of being online and having some portion of that in person.
Well, if you have that split model, why is it so important to be spending at least some time in school? What does that do better than happened earlier this year, at least?
Yeah, so I have a favorite quote that from a child psychologist who is Dr. James Comer, and he says, "No significant learning happens outside a significant relationship." And trying to have that relationship through a computer is much more challenging for our children. And it's just a very different environment. And there's so much socialization that goes on in a school, and so much joy and love that happens when you're dancing and singing and participating in group time with your peers and with your teachers that are preparing those engaging lessons for you. Also, the opportunity to redirect and to really do interventions with multiple teachers and paraprofessionals and other professionals within the school building who provide services to children, because it's not just typically one teacher, it's multiple teachers teaming together to support children, especially children with disabilities or children who are not yet speaking English.
Well, there was a lot of attention to the failures of remote learning, but I've heard of at least one school where it worked really well. Almost all the students were engaged. Between those two extremes, what did you learn from that, and how are you going to do things differently with remote learning going forward?
Yes, we had a number of schools that really got it right and just nailed it, and so proud of those schools. They had morning meeting with the whole school, or the teachers themselves would have morning meeting, and they would do that connectedness, of course, getting back to the relationship. They had strong partnerships with their families, and so they were able to really reach out to families. They had already had those existing positive relationships with families, so it was much easier for them to then transfer that knowledge to families about what they needed to do at home to help their children. So that was also really successful. So we're building off of that. Also, some of the schools that did well were, masterful teachers were really digging in and sharing best practices across classrooms and with one another, and really partnering on that. And then the final thing is that when they noticed someone was off track, they quickly intervened with that family. And so that was also something that we want to make sure that we're able to do and track our students better, make sure that we're able to quickly intervene with them, and then make sure that our families have what they need to help their children be successful.
Speaking of spectrums here, among teachers and other staff in the schools, I imagine there are different levels of vulnerability as far as the virus is concerned. How are you going to deal with that?
So we have existing policies right now for our teachers. Of course, there's the new Family Corona Leave Act for teachers who need to take leave for themselves or for family members. It also is if they are unable to locate childcare, they have a leave request that they can give to our Office of Human Capital. We also have medical leave, which is a doctor saying you're unable to perform your duties, and so they're able to take medical leave. And then just finally, there through our equity office, we are able to make reasonable accommodations for teachers and other staff who are requiring any kind of accommodation, whether that be a certain size chair or desk or any other types of reasonable accommodations that they would need to make.
I know there are some indications out there around the country that infections might not be too much of a problem with younger children, but you've got to be prepared for the worst. And tell me what you have prepared in case that a student shows symptoms, what happens next, and how you contain things.
Well, unfortunately, Chris, there's more we don't know about this virus and its spread, and more information comes out every week than what we do know. And so we want to make sure that we have done everything possible to stay up to date on the science and the spread. As you know, it is spreading a little bit more among younger people now, which is concerning. There were some new data also that suggests that even little kids are containing the virus and can spread it, which earlier we thought that maybe they didn't. So we are making sure that when kids come to school, parents have done their checks before they send them, that they're not sending them sick. We are going to be training our teachers. Already teachers know to know when a child's not feeling well. And then also, asking teachers themselves not to come if they're not feeling well to work. So that will be part of the precaution in the prevention side. And then if we do notice that someone is sick, we will be isolating those students. They will see the nurse. There's a certain set of protocols and symptom checks that they'll do to determine whether that's COVID or just the general cold or flu that the student has. And we'll ask parents to come pick them up and have a COVID test before they return. If it comes back positive, then we will close that classroom of students if it's not been spread to any of the other classrooms. And if that student or that teacher has come in contact and is tested positive with multiple classrooms, then it's likely that school would probably shut down for a period of time before we reopen it.
Well, in addition to toggling between two different forms of instruction here, the school system more than ever has become a provider of essential services. Can you say anything about how that is developing right now?
Well, we're very proud of the pilot that we had this spring. We had never done telehealth before, and we knew that this would be a very difficult time for our students in terms of not only their engagement, but their mental health. And so we wanted to find ways to encourage and have them get the support that they need. And so we provided over 14,000 different contacts to our students with over 80 providers. And so coordinating all of those supports with our partners and our medical health professionals within our schools and also externally has been an important piece to providing for the social emotional well-being of our children. And then of course, when the teachers come back, we're asking them to really reconnect with their students, see how they're doing, create that community and that learning community, have it be full of love and caring, so that we can make sure that students have all of their needs met.
And finally, I know many parents are aware of this as well as many students, but if people want to catch updates online, where's the place they should go to?
So online, they can go to www.bostonpublicschools.org/reopening. There's a lot of information there. It is all translated for families. They can see the full plan, both the draft 1 and draft 2 of the plan, as well as a number of summary flyers and information about how to stay connected, and new information is updated there regularly.
Thank you very much for taking the time to join us and help inform the parents. Boston School
Thank you very
Superintendent.
much, Chris. Appreciate you.
Thank you very much, Boston School Superintendent Brenda Cassellius. We'll have more news in just a moment.